Dr. Paul Spiegel. He's the director of the Johns Hopkins Center for Humanitarian Health, and he joins me live now from Baltimore in Maryland. Thank you, doctor, for being with us on the program. In terms of medical access, we do know that there are thousands of people right now in Gaza that are seeking medical treatment. How pivotal is the Rafah crossing for that medical access?
Yeah, thank you for having me. It's extremely important. It's insufficient because, as your correspondence just said, there not enough people are being allowed to be evacuated. There are over 18,000 Palestinians, Gazans that need to be medically evacuated. 4,000 of these are children. And it's really unclear how many will be allowed to be evacuated and how much also can the Egyptian system actually cope with these numbers of patients.
4,000 of them, you say, are children. Do we know what the current state of these medical patients are in Gaza, those suffering from injuries and illnesses alike?
Yeah, and as you said, it's not just the injuries, but it's also some of the important illnesses where the system itself is still on its knees. You know, more than half of the hospitals are still not functioning. Many of those that are functioning are only partially functioning. We're talking particularly in terms of cancer, cardiac, renal dialysis, all of these really important and slightly more complex cases, excuse me, the current system cannot handle. And therefore, there really needs to be a concerted effort to get these patients outside of Gaza to be able to receive acceptable care. Otherwise, many have and then will continue to die.
Right, and there are those that won't be able to leave Gaza, though. How tough is it going to be to get the necessities that these patients need transferred with these hurdles that Israel is causing at the border?
Yeah, I think there are two issues. So number one is a bit with your last question is that there are a lot of hurdles, as you mentioned, in terms of security, changes in procedures. So it's often unclear how to actually transfer these patients outside of Gaza. And then inside Gaza, there are restrictions, particularly in terms of more of the complex cases. I said issues in terms of limited diagnostic tests that are allowed to be in, limited number of medications that are allowed to be in, certain instruments, medical instruments. These are all still being restricted by Israel. And therefore, even though the doctors in Gaza are actually very, very competent and have a tremendous amount of experience, the patients themselves aren't able to benefit from that experience because of the lack of supplies and equipment.
Indeed, and there's also a limited amount of medical staff as well. We heard from MSF, and I want to read out one of their statements that they've released saying, and I quote, "After months of unsuccessful engagement and without assurances for staff safety, Doctors Without Borders will not share a list of its Palestinian and international staff with Israeli authorities. No staff information has been shared with the Israeli authorities in this process. If MSF is expelled from Gaza and the West Bank, it would have a devastating impact as Palestinians face a brutal winter amidst destroyed homes and urgent humanitarian needs." There's real desperation in that statement, Doctor. What's your response to that?
It's really serious that Israel is requiring NGOs to provide lists of people they are hiring for a variety of reasons. As you likely know, we have 4 humanitarian principles: humanity, impartiality, but also neutrality and independence. And by Israel requesting those names, unclear of what they're going to do with those names. Will there be retribution? Is it a way for Israel to limit the number of international NGOs that they wish to go into Gaza and the West Bank? These are all really concerning rules that are going against the humanitarian principles. So I completely understand and support why MSF and, by the way, many other international NGOs are refusing to give Israel those names. But ultimately, who suffers? And it's clearly going to be the Gazans, the Palestinians inside Gaza. And therefore, I'm hoping that as opposed to taking a stand. I'm hoping that both sides will be able to negotiate without the international NGOs compromising humanitarian principles to make sure that groups like MSF, who are one of the most important medical NGOs, humanitarian NGOs, will be able to work inside Gaza.
Indeed. Dr. Paul Spiegel, thank you so much for being with us here on the NewsHour.